Was true with regular glass and plain insulated glass, but now with new Super E Plus windows.
Welcome to Kirksville College of Osteopathic Medicine's Voices from the Past. I'm your host, Michael Kuchera, D.O. I'm an assistant professor in the Department of Osteopathic Manipulative Medicine here at KCOM. Today's panel will be discussing reflex mechanisms, their application in osteopathic practice and research. And I would like to introduce you at this point to our distinguished panel of prominent osteopathic physicians. Ira Rumney, D.O., graduated Kirksville College of Osteopathic Medicine in 1937. Perrin T. Wilson, Professor of Osteopathic Theory and Practice and Associate Medical Director. J. Stedman Denslow, graduate of KCOM 1929, Professor and Chairman of Osteopathic Theory and Method, Director of Research Affairs, and Vice President of the college. Louisa Burns, D.O., graduate of the Pacific Osteopathic College 1903. She established and directed the Pacific branch of the Still Research Institute. William Kilman MacDonald, D.O., graduate of the ASO 1912, and active in the Scottish Osteopathic Research Institute. Also today we will be joining our roving reporter, Dr. William Kuchera, D.O., an associate professor in the Department of Osteopathic Manipulative Medicine. At this time, though, I am pleased to introduce to you another member of our panel, Jenny Chase, D.O., a graduate of the ASO 1912 and 1917. She was a compatriot and classmate of William Kilman MacDonald. Jenny, you knew Dr. Hildreth in your practice. Your practice has stretched over 60 years. Can you share with us anything that he might have told you as it regards to osteopathic practice and reflex mechanism applications?
Oh yes, I knew Dr. Hildreth personally, and he taught me many things. The one thing that has saved my life with many patients is the way he pounded into me about the 7th cervical, the 1st, 2nd, and 3rd, and 4th dorsal vertebra. Everybody gets checked on that with me.
Thank you, Dr. Chase. I wonder if we might discuss, panel, the importance of this area. Who would like to, Dr. Rumney? Yes. Would you discuss the importance of this area as it applies to reflex mechanisms?
Now remember we said that the sympathetic nerve supply, preganglionic nerve supply going up to the head.
Set up at this point, and perhaps you would share with us how you utilize this area in treatment in your practice.
Now, treating this patient, she had this upper respiratory infection, trying to get good drainage through this thoracic inlet and to come directly at the point we're monitoring. I can feel it localizing under my finger, the movement. She was restricted here at T4 in side bending to her right, rotate to her left, backward bending. As soon as I get this area loosened up, the same person.
Dr. Rumney, do you have any last words for our participants here today?
You may get the concept very easily, but you can never play in Carnegie Hall until you practice on your instrument.
Thank you, Dr. Rumney. We appreciate your demonstration and your advice. Dr. Denslow, you've been very instrumental in the early research days of our profession. Perhaps you could put into perspective our endeavor to visit early osteopathic laboratories and speak briefly about the importance of this early research.
Lessons that we learned in the early years are just as applicable today as they were back in those early years.
With that in mind, Stead, let us take you now to some footage that we shot earlier this week in Edinburgh with our roving reporter. Dr. Bill?
Thank you, Mike. I'm standing here in front of the Scottish Osteopathic Research Institute in Edinburgh, Scotland. where shortly we'll be touring the laboratories of Dr. William K. McDonald. He's an osteopathic physician demonstrating a link between the skeletal system and infertility in rats. I'm told that we're having some transmission difficulties and we'll need to beam this to you in black and white. Dr. McDonald also told me there are some problem with the microphones in the laboratories, but has assured me that the demonstrations will be self-explanatory. Thank you, Dr. McDonald. We'll have to get back to our studios now. Thank you, Dr. McDonald. We'll have to get back to Kirksville now. Your work should stimulate further research in this area.
Thank you, Dr. Bill. It's interesting the research projects that went on in those early days. We'd like to continue now with our tour with a live report in Los Angeles. Dr. Bill.
Thank you, Michael. Through the miracles of television, I'm now standing in front of the Still Research Laboratories at Los Angeles, California, Pacific Branch, where we have come to observe the extensive work of Louisa Burns, D.O., on the thoracic somatic dysfunction and its reflex effect in rabbits regarding the heart muscle and cardiac rhythm. Dr. Burns has assured me that there is someone who will narrate the tour for us.
This is the rabbitry. It is a laugh house which protects the rabbits from predatory animals and ameliorates the weather. These long rows of hutches house the experimental and breeding animals. Each adult rabbit has its own hutch. Of course, other animals such as guinea pigs, cats, dogs, rats, and goats were also used and were among the hundreds of experimental animals used over a 45-year period of research on the osteopathic lesion. On the basis of comparison of the normal lifespan, the rabbit lives about 10 times faster than man. Hence, pathological processes develop at a relatively rapid rate. In these experiments, accurate records are kept for each animal. For each animal chosen for lesioning, a control is selected, which has identical heredity, is the same age, and lives under like conditions of handling, food, care, and other environmental factors. Attendants must be gentle and handle the rabbits with care. No causes of fright or excitement are permitted. All causes of disease, other than the lesion, are avoided. These two animals are alike and of the same family. The normal heart sounds are typical. Through the use of an electronic stethoscope, the heart sounds can be amplified and recorded. This, the normal pulse, is soft, smooth, even, regular. One animal will be kept as a control, and the other lesioned at the third thoracic vertebrae, as shown on this rabbit skeleton. This lesion will resemble that found clinically. It is produced by exerting sustained pressure upon the spinous process and the right articular process of the vertebra. This sustained light pressure is continued until the operator feels a yielding of articular ligaments. A slight maladjustment of the vertebra results. This is the lesion. The most serious disturbance is the effect upon the heart. The pulse is irregular, uneven in force. It has a staccato quality. After lesioning, the animals are returned to their hutches and are examined frequently. Each rabbit is indelibly identified with ear tattooing. Records are made at each examination. Frequent examinations of both control and experimental animals keep them tame and easily handled. Lesions may be corrected by the involuntary movements of an animal. Secondary lesions may follow the experimental lesion. Sometimes accidental lesions occur in controls or experimental animals. These accidents explain the need for frequent examinations. These rabbits now are 17 months old. One is the control. The other has been lesioned 15 of its 17 months of life. The heart sounds of this lesioned animal are still uneven in force and rate. The beats are weaker, necessitating greater amplification. Breath sounds are also amplified. An overdose of anesthetic is given simultaneously to the control and the lesioned animal. The hearts are quickly removed while they are still beating. Note the smooth, strong beat of the control and the weakened, slowing beat of the lesioned animal. The difference in the vigor, rhythm, and period of beating is very noticeable. The normal heart of the control holds its shape because of the resiliency of its muscle, while that of the lesioned is flaccid from undernourishment and loss of tone. This first microphotograph shows normal heart muscle. Notice the general uniformity of structure. The cross striations are not plainly visible on this colored film, however. This is normal heart tissue